Hi, you're watching News 9 Digital. I'm Pratibha, and today we're going to talk about India's vaccine distribution plan. As we know, for a long time we had questions over whether we'll have the vaccines or not against coronavirus, the efficacy of it as well. But now hopes for a vaccine are rising, and with that, the preparations for the vaccine distribution also going on at a feverish pace across the country. And now the centre has already prepared a plan for it and has taken states into confidence as well on what the plan should be. Now, the Union Health Ministry, in fact, has written a letter, and there are key factors to it, three of them. First, of course, that the vaccine drive itself across the country could take up to 1 year. This is quite startling, of course, but I'll come more to that in a little while. The second of the key takeaway being, of course, that this distribution of vaccine would be done keeping in mind the frontline warriors who will be prioritized, so they will be vaccinated first. And the third one being that the states need to prepare for the distribution of the vaccine, including this would also constitute panels as well as task force in streamlining the vaccine itself. Now, the Union Health Ministry has said that the drive to introduce the coronavirus vaccine will span over a year. It added that multiple groups will be sequentially included in the drive, starting from the frontline health workers, and supply of vaccines will be limited initially due to the high demand. The states have been asked to ensure that there is minimum disruption to other healthcare services as well, a very important point in the same as well. The centre had also previously, of course, said that about 3 crore frontline healthcare workers have been identified and will be among the first to receive the coronavirus vaccine. Now, India has not yet signed a deal for coronavirus vaccine, so it is quite unclear when it will be available for use in the country as well, and this throws up several questions in the same regard as well on how the distribution will take place. Several had also raised questions on whether all will have free and fair access to the coronavirus vaccines or not. Remember, as we had several questions coming in already, it also took a political turn like we saw ahead of the elections in Bihar as well. A statement was made. In fact, it featured in BJP's manifesto as well, which threw up several questions on what it would mean for the rest of the country. If free vaccines are promised to the people of Bihar because the state is going to polls, what about the other states where polls are not being conducted at all? So these were the questions raised, after which, of course, the clarification did come in from the government that everyone will have access to vaccines. The pricing of it, of course, has not been confirmed yet by the Union Health Ministry as such. But now, of course, like I mentioned, the preparations have been going on, and the states have already been asked to give a draft on the healthcare workers. There are about 3 crore healthcare workers across the country who have been identified, without a doubt, as is being done in the other countries as well. India will also ensure that the vaccine is given to the frontline workers because they are at the highest risk. After that, the plan is to ensure that they look at the vulnerable group, and identifying this vulnerable group, of course, will also pose several questions because especially we don't have a data on it as well. Of course, despite all the challenges that have been coming in as well, the government has said that it's working towards ensuring vaccine for all, and it has already asked the states to prepare. Even if it might take 1 year, we can rest assured that we will all have access to these vaccines. Of course, till the vaccines come, we need to continue taking all the precautions that we have been taking. So you and I should also continue doing the same as well. That's all I have for you today. Thank you so much for joining me live. Please like, share and subscribe to News 9 Digital. I'll see you in the next video. Take care.